of the 509 cases confirmed with COVID-19 to date, in the last 24 hours, 13 more patients have recovered and have been released from hospital. This brings the total number of recoveries to 113. This is a recovery rate of some 22.2%. And you would have seen that in the last week or so, we have seen a fairly high increase in the number of recoveries, which is a very positive development and in keeping with our expectations given when we discovered the first positive case. 9 persons have died, unfortunately, which is a 1.8% death rate of the total number of positives, which by benchmark numbers based on the short history of the virus is relatively low. Nevertheless, every life loss is a loss, and we regret that. But 9 persons have died from COVID-19 to date. There are now 387 active cases. Of note, there are no moderately or critically ill cases at this time. And that is again worth highlighting that for the most part, and as of now, the positive cases are cases that are not critical or even moderately ill. These are persons who are primarily asymptomatic, and we can comment more on that later on. In terms of the classification, Jamaica now has 41 imported cases. 193 cases are contacts of confirmed cases. So 25 cases are import-related, 61 are related to a local transmission cases, not epidemiologically linked. 96 are contacts of employees in the workplace cluster in St. Catherine. 11 are contacts of confirmed cases under investigation. 24 are local transmission cases not epidemiologically linked. 251 are under investigation. 224 of those under investigation are linked to the workplace cluster, and then there are 27 others. The community quarantine in St. Mary, the Dover, Enfield, and Anota Bay communities remain under 14-day quarantine with effect from Thursday, May 7th, 2020 at 6 a.m. to Thursday, May 21st, 2020 at 6 a.m. That quarantine arrangements are in effect. We have announced the actual boundaries and the restrictions, and when they apply, when they are eased up for persons to do shopping. That is a matter of public record, and that continues. We want to just remind the public, or in particular those in the zone, that mobile pharmacy services are available for persons who need those services. So in the case of Enfield, on Tuesdays 9 a.m. to noon, Dover, Thursdays 9 a.m. to noon, and Anota Bay, Saturdays 9 a.m. to noon. The mobile NHF pharmacy drug serve window is available in those communities during these days and times to allow persons who have requirements, medication requirements, to access their medication. In terms of food packaging distribution, of course, the Ministry of Labor continues to do that, and persons who may have particular needs or require additional information can get that information either by calling the 888 One Love number or by reaching out to the contact tracers who are in the community on a regular basis. 426 patients are in isolation currently. 123 persons of interest are in quarantine at a government facility. In terms of testing, so far we have tested 7,552 samples. 6,998 are negative, and we have 55 pending.